What is minimal risk for vulnerable populations in research? Imagine participating in a study where you face no more danger or discomfort than you would in your daily routine. That's the idea behind minimal risk in research. When studies involve groups like children, prisoners, or people with cognitive challenges, the rules get even more careful. These groups are called vulnerable populations because they might have a harder time protecting themselves or giving fully informed consent. Minimal risk means that the chance of harm or discomfort in the study is no greater than what you'd normally experience in everyday life or during routine medical checks. For example, if a healthy person gets a blood pressure check or a simple survey, that's considered minimal risk. The same applies to children who might get a quick physical exam or answer questions about their habits. When research involves vulnerable groups, the definition of minimal risk is used to make sure they are not exposed to unnecessary dangers. For instance, in research with prisoners, minimal risk is judged based on risks they face in their daily prison life, not outside. For pregnant women or fetuses, extra care is needed to protect both the mother and the developing baby. Ethical principles guide how researchers handle these situations. Respect for persons means they must protect individuals' autonomy and avoid exploitation. This often involves getting consent from the person or their legally authorized representative if they cannot decide for themselves. Beneficence requires that researchers aim to do good and prevent harm. When risks are more than minimal, the potential benefits must be significant enough to justify those risks. Justice ensures that vulnerable groups are not unfairly targeted or excluded from research that could help them. Institutional review boards, or IRBs, are groups that review research proposals to ensure they meet these standards. They check if the risks are truly minimal and if safeguards are in place. If a study involves more than minimal risk, it must offer direct benefits to the participants or produce knowledge that is vital. Balancing the need to include vulnerable populations in research with the obligation to protect them is a challenge. Researchers must carefully consider each person's situation, not just their group membership. This way, they avoid denying access to beneficial studies or exposing people to harm. In simple terms, minimal risk means the chance of harm is no greater than what you'd face in everyday life. Ethical oversight makes sure that vulnerable groups are protected while still allowing them to participate in research that can benefit them or society. Respect, beneficence, and justice are the guiding principles that help keep research fair and safe for everyone involved.